Hello, and thank you for joining us for this presentation about the Service Area Assessment. My name is Nadia Fisher, and I am the Service Insights and Analytics Manager here at Care and Share. This means that my job is to collect and analyze information about the areas and the neighbors that we serve. We're here today to share with you what we did to hear from our neighbors and communities, what we found out, and what we're going to do about it. So before we get started, a couple of definitions. You may have noticed that we like to use the word neighbor. We prefer neighbor instead of something like client or guest because anyone can need help at any time. And the people who access our free food pantries are from right next door. They're our neighbors. And when we use the term partners, we mean the agencies and organizations who have partnered with us to distribute food to the 29 counties in our service area. Care and Share brings in food through donations and purchases, and then we ship it out to our 287 partner agencies who distribute it to our neighbors every week. We literally could not do what we do without them, and we appreciate you all so much. So in July of 2024, we began a thorough assessment of the communities that we serve. And this is new. We've never done anything like this at this scale before. So this presentation, this recording, this right here is an example of our commitment to being intentional about how we show up for you and how we share with you the feedback we've been receiving. In conducting this assessment, what stood out most clearly is that geography matters. As you will soon see, we serve a remarkable variety of different regions, communities, populations, and cultures. And in order to meet our primary goal of equitably distributing food to all of our neighbors, we need to understand and respond to those differences. So as we began collecting information about our 29 counties, we looked for areas where people aren't getting what they need, where the geography of our state might be an issue, or where people might be facing barriers due to their culture or language or origin. In other words, where our passion for equity might not be achieving everything we wanted it to. The goal was and continues to be to listen to the neighbors and the partners that we serve and to find out what's going well and how we can do better. And we were genuinely excited about this opportunity to hear directly from our partners and neighbors. So what did we actually do? The service area assessment conducted 11 listening sessions in 7 different counties with both partners and neighbors. We rolled out a survey that collected over 2,000 responses, 245 of which were from Pueblo alone. We looked at Feeding America data, census data, neighbor intake data, and our own internal data. And from all of this information, we identified 3 major priorities as a focus for this coming year: advocacy, culturally relevant food, and an agency academy. Keep an eye on those icons. They're going to show up again later. So what did our neighbors have to say? Many neighbors left comments describing their experiences with hunger, with food access, and with food pantries. One neighbor said, "I can afford unhealthy, inexpensive, prepackaged garbage, but we can rarely afford fresh fruits and vegetables on a consistent basis." Another neighbor commented, "I do get food stamps, but despite my efforts to scrimp and save, I run out at least 1 to 2 weeks before the next month." Our survey included the Food Insecurity Experience Scale, used worldwide by organizations like World Hunger to quantify the experience of hunger. The scale asks 8 questions, such as, during the last 12 months, was there a time when, because of a lack of money or other resources, you were worried you would not have enough to eat? Please note the phrase, because of a lack of money or other resources here. So when the question asks if someone skipped a meal, we're not talking about fasting. Some of us may have gone a whole day without eating for a variety of reasons, but here it's specifically because there was no food available. So when someone answers 7 or 8 of these questions with yes, They are considered severely food insecure. By contrast, up to 3 yes answers is considered food secure. Our survey showed that 54.2% of neighbors identified themselves as being severely food insecure. Another 26.7% showed moderate food insecurity, meaning they answered yes to 4 to 6 of the questions you just saw. Neighbors across southern Colorado told us in comments and focus groups that what drove them to seek our services were things like insufficient benefits, disabilities, illness, mental health issues, or family circumstances such as death, divorce, domestic violence, or other impacts to income and financial situations such as moving, homelessness, high costs, or lack of employment. Neighbors expressed a lack of information, not knowing where to go to access free food, not knowing what the requirements were, or whether they would qualify, or trouble navigating the system or websites. Many neighbors also expressed gratitude for our services. They told us that food pantry staff and volunteers were kind and welcoming and treated them with respect and dignity. Neighbors also told us very clearly what kinds of foods they were hoping to see at our pantries, some of which might even be possible. So let's zoom in from our entire southern Colorado service area to look more specifically at the region represented here today, the Eastern Plains region. This region is made up of 3 zones, Pueblo County in the middle, as well as the Front Range zone, made up of Fremont, Custer, Huerfano, and Las Animas counties, and including larger towns like Canyon City, Walsenburg, and Trinidad. And then what I like to call the geometric counties on the Eastern Plains in the Southeast zone. In this Eastern Plains region, that food insecurity experience scale we just talked about shows up a little bit differently. 50% of neighbors in this region reported severe food insecurity, which is 4 points less than southern Colorado overall. 26.3% reported moderate food insecurity, which is about the same. What accounts for that difference? One of the factors here is the number of responses we received on the survey. If you remember the earlier slide, 232 neighbor responses were from Pueblo zip codes, but only 82 from the southeast counties and 58 from the Front Range. So these reported numbers may not be representative of the region as a whole, although they do provide some important insights. 9.8% of neighbors across southern Colorado reported experiencing disrespect from staff or volunteers at a food pantry. In the Front Range, that number is 12.1%. In the Southeast, it's 11%, and 14.2% in Pueblo. These are a couple of comments from neighbors in this region who answered yes to that question. Neighbors answered questions about barriers that prevented them from accessing free food. 73.5% of neighbors identified transportation as a major issue. That's these first 2 columns taken together. One neighbor commented, "I have a difficult time getting the food home." For the next highest category, 29.5% of neighbors said that the hours our partner agencies were open were a barrier. In the comment section on the survey, they expressed difficulty finding a pantry open outside of work hours or around appointments, or they mentioned the amount of time needed to stand in line to enter the pantry. For example, one neighbor commented, "For people that work traditional full-time hours, it's nearly impossible to get to a pantry during open hours." Our survey also collected responses from our partners. Here are some comments from partners here in the Eastern Plains region about their frustrations and challenges. I want to point out that all of these comments are about partners wanting to do more for their neighbors. Partners want more resources so that they can expand services and meet neighbors' needs more effectively. Consistently, the highest concerns from both responses and comments were about food and funding. This chart shows the various sources of funding reported by partners on the survey: grants, churches and nonprofits, government, food drives, mailings, websites, none at all, and other. Here's that same chart for Pueblo, for the Southeast Zone, for the Front Range, and for Pueblo. So while partners in the Front Range reported relying heavily on local churches or nonprofits as an income source, partners in the Southeast and Pueblo seem to be significantly more successful at funding their pantries through grants. So we're hoping to tap into your expertise to help offer trainings and workshops for other partners. When asked about the sustainability of their pantry, 98% of partners indicated that they have the plans and resources in place to continue their services. However, about 79% of those same partners indicated that some kind of change was needed soon in order to continue serving neighbors effectively. But I want to point out this number here. Only 8% of partners told us that they have a plan in place if and when their current leadership retires or leaves. This lack of succession planning is a concern for sustainability. So let's get even more specific. As I look at each of these zones in more detail, I'm going to start with what we heard from partners and then move on to neighbor feedback. We heard from Front Range partners that they were looking for more ways to expand their services, wanting to add delivery services, weather protection for lines, and more and wider distributions. They also expressed that while support from Care and Share has been strong, better communication and clearer direction on how to navigate processes would be helpful. In Huerfano County, partners told us that they wanted to provide more education for their neighbors about food systems, cooking, canning, and gardening. Partners want to host cooking classes and start community gardens so that neighbors can both be more self-sufficient and more connected to their communities. Although about 38% of the neighbors they serve are seniors, partners in Huerfano County expressed concern that families with children who needed assistance weren't coming to the pantry, and they were looking for ways to reach out to them.